Welcome, everyone. Today we're talking to Geoff Turner, advisor and consultant to several exciting companies in the prosthetics and orthotics space, including Humotech and our sister company, Realize Labs. Tune in to learn more about how to align individual patient needs with business objectives. And now, here's Geoff Turner. Hi, Geoff.
How you doing?
Good to talk to you today. Thanks for joining the podcast.
Oh, it's my pleasure. I was looking forward to it. It should be fun.
You and I, of course, have been working together for a while on several projects related to building and selling innovative products in O&P. It's been fun. It's been interesting. I'm hoping you can kind of start us off with an overview of your career to date.
Sure.
You've been testing and breaking products long before I was even engaged in this field. So I think it's a really interesting backstory.
All right, sure. Happy to chat about it. So, I got involved in prosthetics. Obviously, I'm an amputee, so that was sort of the segue, right? As often happens. As I became sort of more curious about what things really were and what things might work and why some things aren't available, I would start to get closer to the manufacturers. And so I got to know some of the guys at what was then K-Tech and Otterbock, of course, a little bit, mostly OSA. I got pretty close to those guys. And we got to a point actually where they were literally just boxing a knee to me every week from Albion, Michigan, and just shipping it to my home. And I would, devastate it and write my notes and send my comments back. And it was gratifying. I mean, it took many years, by the way, to get to that point. I mean, there was many conversations over the years, and I had various involvements with prosthetics from doing dog and pony shows, wearing prosthetics at events, and starting to get involved in being more active in the amputee community. So I got attached to and a lot of help from the Challenge Athletes Foundation out of San Diego, because I was living in San Francisco at that time. This story is going to move around a bit. So
that's fine.
Okay. So
tell us about athletics. So that's an interesting piece of your journey.
Yeah. That was fun. I mean, look, it's funny. When I was living in San Francisco, one of my roommates one day, fairly early on, saw me on the carpet with like bits of broken prosthetics and knees and feet, and nuts and bolts and screws, grease strewn around me. And he said, "What the hell are you doing?" And I said, "Oh, I'm building another running leg." And he just sort of looked at me. He said, "So you're a leg amputee?" I'm like, "Yeah." And he's like, "And your chosen sport is running." He just sort of walked off. And for some reason, I hadn't really put that much thought into it before. But anyway, so I don't know why I was so determined to do this. I think in part because when I first lost my leg, it was in Australia. It was a shock and horror motorcycle accident. And so my first appointment with my first prosthetist, I asked them what my future held, what the capabilities would be. And one of the things I asked was, will I be able to run? And their answer was, don't expect too much. And so I didn't like that answer. And so I promptly decided to try and run with the various bits and pieces that I had at that point, and managed to break my other ankle and refracture an arm that had just been pinned and plated. And this was while I was in hospital showing off physical therapists at Royal Brisbane Hospital.
Oh my.
Yeah, I know that's a story for another day. But anyway, the point is, it's a challenge to do these things as a leg amputee, and the higher the amputation goes, it gets exponentially more difficult. I have so much respect for folks like hip dysartics who do stuff like this. I'm just like, my God, So I determined after they told me that I shouldn't really. And by the way, my question to them was, will I be able to run for the bust? That was my question. I mean, because when do you run in life? Most of us don't run very much. It's like, tigers aren't chasing us anymore. So you see the bus coming down the street and you're about to miss it. You're going to be late for work. Are you going to run that, a couple 100 meters? And that's what I wanted to know. And they were like, well, don't expect too much. I'm like, got to be garbage, right? And I thought about running marathons and doing triathlons in the past. I mean, that had popped into my head as something maybe I'd be able to do. But it was always just something I was thinking about doing one day. And then, of course, once I lost my leg, that's all I could think about. It's like, well, I got to be able to do this now because, it's like my theory was, if I can run, I can walk. And if I can really run, then I can just like regular run, right? That was kind of my philosophy on this. And so, yeah, I ended up breaking lots of stuff, right? Knees and feet, and getting really close to the manufacturers. And they would sometimes, I would get a running blade, and it would, like, the first running blade I had, I think I was trying to cross the finish line at a 5K in San Francisco, Golden Gate Park. And just as I was crossing the finish line, this woman decided to race me into the chute. And she just hit me. She just got in front of me, and she crossed the finish line and stopped. Like, I don't have brakes. It's like, I'm like a rock rolling downhill when I'm running. It's just like, I'm just like, look out. Give her a big bear hug. We both go flying, and just shredded my running blade in the process. She, thank God, was fine. I think she landed on top of me. But anyway, the point is, the manufacturers were really nice. I mean, I called up and I was like, oh my God, I've ruined my first race. I've ruined my running blade. They're like, don't worry about it. They sent me another one. That was just, that kind of stuff made a huge difference. And then, of course, Challenge Athletes Foundation and groups like that help people, because manufacturers will gift these running feet to these groups so that they can be distributed amongst the community with active amputees. And that stuff's really, really cool. But I guess my goal really, probably, if I get down to it, and to answer that first question, we go back to the start, sitting on the floor with a bunch of bits around me. Why was I running? Because if I could put this leg on, I could get up in the morning, I could go to the gym, and then I could come home after going to work, and then I could go to the track and I could put in a 5K. Then this thing works from my perspective. Now, this is a functional limb, right? Now we can do just the basic activities of daily living that I wanted to do. And I wanted prosthetics to be able to do that. And there weren't prosthetics that were designed to do that at that time. They just weren't. There were no running knees. And actually, when I first started, there were no running blades for people like me. They were making running blades for BKs. But the first running blades for AKs were just this weird looking J-shaped thing. It was almost harder to run with it than a regular foot. It was just crazy. But it was just like, they were just like, oh, I guess we just go like this and we bend it, right? And then, but the BKs had these crazy looking things that looked like the modern running blades of today. I'm like, why don't I have that? That looks really cool. And like, oh, that won't work for you. And it's like, well, why won't it work for me? Have we tried it? So that was kind of the dialogue and the back and forth of the manufacturers. And I'd prod and needle, and they'd try stuff and they'd send it to me. And it was fun. I know I'm not the only person out there who was doing this. I'm sure there were lots of people. So it was an interesting journey.
So how did you, that's fascinating. How did you cross from obsessing over getting the details of the leg just right for yourself and the activities that you wanted to do, to thinking about the industry at large and starting to kind of roll up your sleeves and work with the companies on the product and business development?
Well, I was actually asked by my prosthetist. So Garrett Hurley was a prosthetist in San Francisco, and he asked me one day, we were, swapping ideas about, sockets, right? Prosthetic sockets. So a big deal is the interface, right? The connection to the human being. So we were swapping ideas about that. And he said, look, if I ever create a business, would you be interested in being involved? And I said, yeah, sure. And then a few years went by, something got going. And so he got a partner, and I ended up meeting with them, and we talked, and then, I shared some ideas, and then so they went away, and I went off and I was doing my own thing. I was working full time at a law firm in San Francisco at the time. And then, I got wind that they were going to San Diego to do some fundraising. And obviously it was my process. I said, you know, I know a lot of folks down in Southern California who are involved with fundraising for the amputee community, right? But this is, you know, for things like sport. It's not fundraising for some companies. And they said, well, you know, would you like to come along? And I did. And so that sort of got me into a place where, you know, I could get closer to them. And I ended up working for them part-time. I was actually the, believe it or not, I was a part-time chief operating officer for a while. so I had a full-time job, and then I was a part-time chief operating officer that I would squeeze into lunches and evenings and weekends. So I'd leave my daytime job, and then I'd cross the street, and across the street was one of those new cafe/workspaces with little like silent phone booths and desks and things, and I would stop across there with my own laptop and open it up there. I'd be like trying to do work and get some stuff done, fire up some emails, make some phone calls, and then I would run back across the street and go back to my day job. And so I did that for some months.
That sounds like a testament to kind of having an open mind and being in the right place at the right time.
Sure, I'll say yes to that. That's flattering. Okay.
Well, you must be doing something right, because you've kind of repeated this a few times. You work with several companies now. I guess you left the law career behind, but I'm curious, is that, I mean, it's quite an undertaking, getting a law degree and practicing law. Has that stuck with you? Do you use that in your day-to-day, thinking about prosthetics?
You know, it can be surprisingly practical. I think in the reimbursement realm, it's sort of interesting, and not, I mean, even just personally, there is some interesting language in plan documents and insurance plans, and you know, when you phone up somebody and say, you know, I need to speak to somebody because there's a problem here in your contract language, it's going to cause you difficulty down the road. And I don't want to cause you guys trouble, but you should know that you're doing the wrong thing. So think of me as helping you, and in the process, you know, I'll help myself. But yeah, I mean, it's interesting sometimes what goes on with insurance documentation.
I feel like, I mean, you know this, at startups, small startups, you got to wear many hats. And as COO with a law degree in your back pocket, that was probably pretty useful. Legal's one of those skill sets that is often externalized to outside firms, which, you know, is fine. There's lots of good law firms out there, but it is a very expensive skill set to hire by the hour.
Yeah, it is. It is. But look, at the end of the day, there are specialties, and there are things that companies need help with. You know, you just need to sometimes bite the bullet, right? And talk to somebody about, you know, intellectual property or something like that. I mean, that's a whole world unto itself. But yeah, I mean, I think it's always something that's it's a useful thing to know, and it can be a useful degree to have. I don't know.
So will you start your own company one of these days?
Well, I just got a CNC machine. Maybe I will. What
are you doing with that?
Well, there's a cool young luthier out in Oklahoma, and I recently taken to torching a couple of electric guitars that I bought. So I'm going to finally decide. I've been carrying guitars around with me for a long time. Maybe lots of acoustic guitars parked in corners of rooms and not used for a long time, with the aspiration that I would learn. But my eldest son is actually shredding now. He's in a couple of years gone from not knowing anything to being a pretty darn good heavy metal guitarist. So and one day when we went to the store, he said, "Hey, Dad, get yourself a guitar. You've always wanted to learn to play." So one guitar has turned into 2, and his one guitar has turned into 4. And so anyway, it's become an interest. So yeah, and we have some ideas about some interesting materials and electric guitars. We'll see what happens.
That's awesome. It sounds like in another life you could have been an engineer.
I mean, that's really interesting. But I mean, it's funny you mention that, because I think the thing that really got me into testing prosthetics was I like mechanical things. I mean, I like testing properties, and I mean, one of the law firms I worked at, I was doing Complex more than anything else, and then I ended up because I got a roommate of mine hired to do some software work, and that turned into a whole like internal business intake process that I helped design with him and a lot of the other employees. And they ended up doing QA. I mean, it's like they're doing software QA, and systems administration and helping to manage a Citrix environment and this sort of interesting novel business intake system using a whole lot of different applications and workflow programs. And all of this was something I knew nothing about before I got interested in that. But I guess I picked it up because I like these things, it's like, which is funny because I worked for Greenpeace for years. I mean, that's what got me interested in law in the first place. And I'm not a Luddite. I mean, I think a lot of the folks at Greenpeace could perhaps have been accused of that. But, I see technology as sometimes a problem and sometimes a solution.
Yeah, I think from my perspective, being involved with you and kind of getting your perspective on product developments, you have this amazing ability to provide sort of the very straightforward, every man's perspective on the technology. You unfiltered, just you tell it straight. But then you also, have that kind of engineer's mind that kind of appreciates and understands all the intricacies and the complexities around why things are the way they are, which is quite helpful.
Well, I look, I have to say, you know, um, I was really interested in what you guys were doing back in the day when I was, first working for and with, Limb Innovations. And so I saw and heard about you guys, and one of our engineers, Jesse, was uh, from Pittsburgh. I went to school there and worked at the robotics program there at Carnegie Mellon. And so, yeah, it wasn't a stretch for me to find out about you guys, and that's so cool. It's like just, and I was like, emulators. That's a really cool idea. And then, you know, I don't know. It's funny that we ended up working together. I couldn't have foreseen it back then.
Yeah. Well, we're grateful. Um, so yeah, you mentioned emulators. I'd love to kind of talk a bit about that vision, but you and I have talked about this so much, but not recently, I guess.
Sure.
As someone who has experienced the process of designing and fitting limbs countless times now, I mean, more than normal, given your interest in sort of experimental technologies. How far off do you think we are on this vision that we have of being able to go into a clinic and using a robot to rapidly test drive different products, and maybe even one day, 3D print that perfect running blade? Yeah, well, I have my answer to this question, but I want to hear yours.
Look, I think technologically, how close are we? I think we're very close. And so, yeah, I mean, I think it has more to do with the will of the players to embrace some of these technologies and concepts. And look, I, you know, I'm, you know, I'm pretty deep in the O&P industry at this point. It's like I resisted it for a long time. I'll be honest. I was curious about it, and I tried to stay at arm's length for a long time because I just thought this is just going to swallow my life if I'm not careful, if I get too close to this. And then I ended up like deep. I'm like, what the hell? Let's go for a swim. So, I mean, at this point, I have a lot of respect for the O&P industry. I see some of the shortcomings as well, obviously. And so, like I said, we're playing nice today, and I'm going to be a good boy. I think, it's time for sure for the industry to stretch its wings a little bit beyond, microprocessor needs. I think it's time. And I think emulation makes a lot of sense. And I mean, there are certainly companies that are, developing, robotic concepts like power knee and things like that. I think we need to move into, more advanced R&D processes. And I think what's really cool about emulation is, when I talk to people, and I have talked to a lot of people high up in engineering and R&D at the major players, I mean, they speak to the importance of human interaction and human feedback. It's really important to them, and they'll say, "But we've got to hear from the people involved." And that's the cool thing about emulation. It's that human in the loop concept is so critical.
In the early days, you were mailing knees back and forth, right?
Correct.
To test every iteration, and maybe some of that is about durability and robustness type engineering. The purpose of emulation, from my perspective, is more about mechanical function. But it seems like just uh, eliminating that need to mail products all across the nation or the world in order to get them tested could be a huge thing.
Absolutely.
But we need more emulators in the world for that kind of access to be there.
Yeah. No, I think that's absolutely true. I mean, when I actually tried the emulator, when was that? It's over a year and a half ago, a year and a half ago now, something like that. When I tried the emulator, that was such a cool experience. I think the thing that was shockingly impressive to me, I mean, I switch feet sometimes. I mean, and it's pain, but to be able to just hot swap, and emulate a prosthetic foot onto the bottom of my microprocessor knee, and just drive it, just walk it without any fuss. I was impressed. I mean, I really thought this was going to take us all afternoon. Within minutes, I was up on the treadmill and it was working just fine and dandy. I'm like, this is really impressive. And then to be able to ask the guy piloting it, hey, what would it be like if it was, if there's a more pronation, what would it be like? If I had a stiffer lever arm, what would it be like if it was softer? And just to be able to make those changes on the fly was so cool. And to know that in the system you're collecting the data as well. You do real time changes and data collection and user feedback all at the same time. Like the value in the systems and this is just the beginning, right? I mean, this is just feet.
Yeah.
It goes through the entire realm of wearables. So
Mhm.
no, I'm sold.
Thanks for that, Geoff. Yeah, I mean, it strikes me, and I'm sure this is true for many others that are developing technology for this field, that like the time is now. The technology is here, and sure, there's more development to do. In my opinion, that development is mostly about scale, like building what you build better, bigger, faster. We don't need some quantum leap in technology to greatly improve patient outcomes. That's my opinion. That comes from working, for however long I've been in this field on kind of the same problem set for so long. You get intimately familiar with the potential and also the blockers. Um, I'm curious your perspective on those kind of impediments. They tend to be more on the business side of things, convincing the powers that be that a particular technology is sort of worthy of investment, worth trying out and maybe failing on. Why has that gotten so hard in this field where, other technology areas seem more willing to kind of move fast and break things?
That is a very good question. I mean, I have thoughts. And so, some of the things that pile up here, I think most of the development was essentially relied upon the individual clinicians, right? So somebody would have an idea. Most of the developments around, for example, a prosthetic socket were around shape. So, quad socket, or whatever particular magical shape is going to solve everybody's problems. So that was going on. And then, they used to make sockets out of wood, so they would pop on a lathe, I guess. That's why wood is called that. And so you would make sockets that way. And then Grumman was like, hey, to somebody who made legs, probably in Long Island, and said, hey, have you, seen this fiberglass stuff we're using, right? And then the next thing, they're making out of fiberglass, and there's changes the scalability. And then later on, they were like, hey, have you seen this carbon fiber stuff we're using? So they started using carbon fiber, just another kind of fiber reinforcement. And so there seemed to be advancements, but most of them were very sort of cottage industry, one-off, and that's part of it, right? So for the clinician, it's one patient, one leg at a time. And so the notion of scalability becomes difficult within that industrial framework. Now, as larger manufacturers started making more and more of the leg, things have started to shift, but it's been a very slow bleed. And so because back in the day, the prosthetists, and not that long ago, by the way, the prosthetists made the whole thing. I mean, the prosthetists literally made everything out of wood. And then there was some more advanced bits that came along, like the Malk knee in the 50s and the 60s, which was still the standard all the way up into the aughts, right? You was still like the Malk was the holy grail of knees. Well, that thing was from World War II, basically, from a German engineer out of World War II, designed in the 50s, then marketed in the 60s. And that was the holy grail for decades. Until some Canadian kid came up with the C-leg, which Otterbach bought. And so, that's kind of what's been happening. So the prosthetics used to make the whole thing. Now they buy most of it, right? Now most of it comes to them. The knee is an exoskeletal knee. It's complete. The foot is more advanced now. The feet have come a long way. I don't think we need as many feet on the market as we have. We come a lot with choices. A lot of them do the same stuff, whatever, that's fine. That's the marketplace. And so we have lots of feet. We have lots of knees. The socket, I believe, just got stuck in time because of the way it was made. Companies I've been involved with, as you know, have been trying to move the needle on that. That's been a painful, laborious process over the past 10, 15 years. And so, the question becomes, how do we move the industry and these other things? Well, it's going to take the manufacturers. I think that's, at the end of the day, it's going to take the manufacturers to step in, because no matter how many offices an O&P group has, I don't think they can handle a lot of the large expenditures, particularly because of the other pressure. So we've talked about the clinicians and how they're sort of painted into a corner to a certain extent. Now we talk about reimbursement, which is kind of what squeezes everyone, right? So at the end of this pipeline of ideas, right? So we have ideas about what we want to do for an individual. We have ideas about what we could do for the group. And we have ideas about what we could do for the industry. At the end of this terrific collection of ideas is a choke point, which is medical reimbursement. And so there have been developments that have really eaten away at the profitability of O&P establishments. It could be said that there was a time when maybe O&P shops were making too much money, right? But now they're certainly not. I mean, now they're really up the gun. And when you have, like there's Medicare. Medicare's great, okay? But Medicare pays 80%. Well, if you've got Medicare and a supplemental, now you get the full bite of the apple. Terrific. Right? That's great. But, if you get a flyer in the mail and you sign up for managed Medicare, what you probably don't know is now instead of 80%, managed Medicare is going to pay 70% of Medicare rates, or 60% of Medicare rates, or 50% of Medicare rates. It's like, so, sure, you're getting your prescription's cheap, but when you go see your prosthetist, all of a sudden they're not very friendly anymore. They don't want to spend all the money anymore, and you can't figure out why. It's because your reimbursement is tanked. You didn't realize that when you switched over to a managed Medicare, that would happen. So this is the kind of complication that's way above the pay grade of most folks out there who are just trying to get by. So those pressures, I think, are squeezing the toothpaste back up the tube. And so we need to figure out how to fix that as well. have all the answers, but I think uh, uh, more L codes would be a nice thing. We have a very prescriptive system, right? It's medicine, so that makes sense, right? But it's very prescriptive. I mean, it's like if you want to move out of the box, there's no L code. Well, there's no L code, nobody can bill for it. Well, what do they do then? What are they expected to do? Oh, well, there's off codes. That's fine. Just do a 59999. It's like, yeah, well, good luck getting an insurance company to authorize that unless the patient is activist. Now, I've been described that way. Yes, I typically get what I need, but it's a part-time job on the telephone to make that happen.
Mm-hmm.
I mean, I think the last time I really dug in and fought with an insurance company probably took me 6 months of daily phone calls. And
Wow.
that's just, I started doing that from day one. I realized how it works in the United States. I'm like, oh, I get it. You just have to keep calling until you get kicked in the food chain. Eventually, somebody is going to be tired of you and say yes. And so that's a big part of it.
It seems to me that the challenge boils down to the fact that no one clinical care provider sort of owns the continuum of the healthcare services and thus the quality of life outcomes for the individual. So the only person that experiences this whole path and all of the pain and difficulties is the patient. And so they can advocate for themselves. But yeah, it's generally hard to advocate for your own medical needs. I mean, we're generally not the experts on most of the issues that crop up with our bodies. And instead, we rely on a health system to kind of support, and we sort of assume that the system will, do the thing that is in our best interests. It feels like it breaks down because of just how interdisciplinary O&P is, which is like not inherently a problem. I think interdisciplinary work is great, but yeah, how do we get everyone all sort of singing from the same page when there's kind of this um, confusion around, or not confusion, but just sort of lack of clarity, around the sort of optimizing the final outcomes.
Yeah.
We're not going to solve this on this call, but I'm curious what, like, kind of your perspective, as an individual and also as having consulted with other companies. I mean, I know that, there are those exceptional prosthetists out there that, they've gotten really good at uh, getting certain more experimental things paid for, but it doesn't, again, like getting back to the comment before, it just doesn't scale.
It doesn't. And the difficulty is, I think, that it's such a competitive field. I mean, look, I worked at the San Francisco Public Defender's Office for a while, and I had to help represent some fairly shady characters, and I have to say, it's been more colorful in prosthetics than it ever was in criminal law. So yeah, it's very competitive. Some might say cutthroat, and a lot of practices are very good at picking their patients and attracting patients who have easy reimbursement. And look, that's the system. That's the environment they swim in, and that's fine. And if they're good at it, so be it. But it doesn't necessarily mean that it's the success of various clinics is necessarily based on clinical outcomes. It can be more about business savvy. I mean, that shouldn't surprise anyone. But I think that gets back to the criticism of the general model in the United States, right? Where it's like, so, I mean, I don't want to get into the whole thing about single payer. It's interesting. I mean, look, like, I'm going to tell you this. I always felt like I did better here than I did in Australia. I lived in Australia for 20 years. I was actually born in the UK, but I I was an amputee in Australia for a fairly short time. I did manage to get a couple of legs going. I had to fight tooth and nail and call up my member of parliament, and because my first leg was garbage, and I just called it a foot on a stick, and I kind of called up and I yelled at them and told them that this is not appropriate, and I ended up getting another prosthesis, which was not normal. I didn't know it wasn't normal. I was peed off, so I just called, right? So when I came to the States, same kind of attitude, right? So people said no. Prior, the big one when I first came to the States was that I'd already been given a leg, so I was dumb. That was the big one, right? So I would call up the insurance company and say, "Well, you've already received a prosthetic leg, so we're done now." And I'm like, "Yeah, well, I bought socks as well. I'm going to need some more of those at some point." And so I got into a sort of a thing with them, went back and forth, and that's when I found out that it was really about the date that you were delivered. It wasn't about the fact that you were delivered, and they were sort of shy on giving me the full details. And then I found out that it was only about you'd received a prosthesis within the preceding 12 months. But by that point, I was out of the 12 months, so the argument was, you see what I'm saying. So it was a legal argument, and this is once again an example of, as an individual, I was able to resolve that. But if I wasn't as persistent, or if I hadn't insisted on knowing what the specific contract language was, and this is before I went to law school, this is back when I was fundraising for Greenpeace, right? If I hadn't been so persistent, I wouldn't have found that out, and I wouldn't have been able to say, well, then it's not a problem, is it? So you'll be paying now, right? And they were like, yeah, I guess so. So that's our model. I've done okay because I can be a pain in the neck, right? So I've done okay. But for the majority of people, it's a huge impediment. And when I tell them to be a self-advocate, they suggest ways that they can manage this and what they should be looking at, and read your plan booklet. Read your plan booklet with the overarching plan, because there'll be language going across those two documents, and it's the four corners rule. The whole contract is both documents. You've got to review them both. Don't just rely on your plan booklet. You'll only have half the story. And I can I'm on the phone with people, but I can feel it going over their head as I'm talking to them. And it's so frustrating, because I'm like, it shouldn't be this hard for them. They've lost a leg. It shouldn't be this hard. It sucks enough. Can we not make it suck anymore? It's like,
this is a totally harebrained idea, but it's almost like you need, like we have health, vision, and dental coverage. It's almost like we need an O&P coverage. It's just it's a different ball of wax than kind of mainstay medical services.
Look, I think there's something there in terms of what would give better outcomes. And I'm serious. You're right, because it's just such an unusual area of medicine. When I first started working with the University of California, San Francisco, when I lived in San Francisco, when I first started working there, and I went to their O&P practice, it was like down in the basements, down with, radiology and, everywhere else where they needed lead shielding, and it's like, it's just, and I realized that was the standard, right? It's like, and it changed and it's become more high profile, and they have nicer offices now. But when I first was in the 90s, living in San Francisco in the early 90s, it was literally down in the basement. That's what prosthetics was. It was very much an afterthought. My take. Do we have time for another story? I don't know how we're doing. All right.
Yes, we do.
So, I don't know if I've shared this one with you before, but when I first lost my leg, and I tell people this, and in fact, I've talked to orthopedic surgeons about this, and they agree. But when I first lost my leg in Australia, it was at a teaching hospital in the Gold Coast in Queensland, and it was a motorcycle accident at night, and I ended up in the hospital, and somebody very close to me at the time was a nurse there in the hospital, and they were there, and it's like, there was my leg in a bucket of ice, right? And they're like, well, here's your leg. And it was actually below the knee amputation, traumatic, right? And they're like, well, the surgeon doesn't think there's enough below the knee to salvage your amputation as a below the knee amputation. At that point, as far as I was concerned, it was just a leg off. That seemed like a bad thing, right? And they said, so Right.
You're
And
freaking out.
I'm like, okay, well, by leg as they carried away, right? And then I had the amputation, and I got out pretty quickly. Fortunately for me, they did knee disarticulation instead of what usually happens. Most surgeons tend to go 4 inches below the knee or 4 inches above the knee, and that's it, right? And so disarticulation is an option that I don't think is taken enough. It's a really good level of amputation, good functionality. You can end bear. I could go in about a half an hour, but it won't. Um, but the story of this really is my result was actually pretty good, even though I wasn't below the knee amputee, which would have made my life incredibly easier, right? And the cost of prosthetics goes up exponentially as you go up the leg, right? So a BK, basically a socket and a foot, right? So that's what you need. For an AK, now you need a foot and a knee and a socket, right? And the knees can be very expensive, especially if they're good knees, good high quality microprocessor knees that have good functionality, right? So, but I was happy. My result was good. I was mobile. I was already walking around without crutches or anything else. And I was in the cafeteria at the hospital because, as I said, I knew someone who worked there. And I saw my surgeon. And I knew it was my surgeon because he'd been pointed out to me. He was this young guy who was sitting over at his lunch. And I walked over and I excused myself. I said, "Hi, I don't know if you recognize me. I was looking great last time you saw me, but you did my amputation. And I just want to let you know how grateful I am. You did what I think was a really good job. I'm doing okay." And he looked at me like I had just fallen through the ceiling. He had no idea what to say to me, no idea what to do. I mean, I don't want to beat this person up. It was just an odd exchange. And I remember to this day that person clearly was uncomfortable. Um, and I figured it out later. And I'm not saying this applies to all surgeons, but I've spoken to a number of surgeons about this, and they tend to agree that yes, amputation is the point of failure. The job of an orthopedic surgeon is to keep you in one piece. And when they can't and they have to amputate, you're a failure. And so at that point, they're like, I don't want to think about that, right? And move on to the next possible success. And that's sad, but true. I mean, certainly there are surgeons to surgeons. Like I think, just vascular surgeons, they're pragmatic about it. They understand that they're probably just going to start taking more and more off over time, right? And they're used to it. And so I don't think they have quite the same attitude. But certainly most orthos, or I know orthopedic surgeons and worked with them professionally who were going to do limb salvage. And so, one in particular who was going to do limb salvage and ended up, being CEO of Limb Innovations. I mean, he completely flipped the script in that regard. From I'm going to do limb salvage, and then he looked into it and he's like, "This quality of life in limb salvage is not necessarily very good." There are people who fight for years. So anyway, I guess my point is, care teams have an interesting attitude around prosthetics. When I say interesting, sometimes it's not great, right? Which is, you can be seen in some regards as a point of failure. And rehab medicine varies so dramatically from city to city, town to town, region to region, state to state. What you get, do you get a really well-trained physiatrist, who's skilled, that has a good PT team who's there to really help you get the most out of your life again and get back as many of your activities of daily living as they can? Or are you just there to waddle between some parallel bars until they can say you're stable enough to send you home? Good luck, right? And huge difference. And it's the same with prosthetic care. The swing of the needle is dramatic from, excellent people who really lose sleep over their patient to folks who are just, clocking in and out and making limb buckets and don't care. I mean, you get all of that and in between. And what does that mean? I don't know. Maybe that's just life, but I think you're right. I think this shouldn't just be left as some part of general medicine. I mean, it's like, I guess it's in the rehab bucket, but maybe we do need to find some way to manage it that's not the way it is now.
Yeah, to me, it speaks to the scarcity of expertise So if we lived in a world that was the same as the world is today, but there were 10 times as many physiatrists who were expert in prosthetics and 10 times as many of the most excellent O&P clinicians, we solved the labor shortage problem. Yeah, that would probably result in vastly improved outcomes. But how's that going to happen? I mean, I know there's a lot of work in this area to grow the professional training programs and raise awareness of the field, but it seems like the tides are sort of moving in the wrong direction. Um, and so technology could really help, right? Like we can develop technology solutions uh, relatively quickly, and if we give the scarce group of clinicians better tools, then they can do more great work in a day. So this is just like technology 101, right? I mean, this is the purpose of technology. This is why man created tools in the very beginning, because, we got tired of fighting tooth and nail for every meal.
Right, right. I think there's a sense people think that humans were these, yeah. Like I had a friend, we used to go hiking, and they would say, "Oh, look, a bunny, nature's snack food." And I think I think there was a notion that somehow that's what people used to be. We actually weren't. From what I understand, most large, carnivores stayed away from us because we were trouble, right? We had fires, sticks, rocks, and there was a whole bunch of us, and we moved it like aggressively in group ways, right? And so then we were just unsettling, right? So yeah, they'd pick some of us off once in a while, but we were not apparently the main thing on the menu. Let's go chase a gazelle, right? They're faster, but stupid, right? So that's fine. Yes, this is what we do. We make tools and we help each other with them. That's what we do, and we shouldn't let things get in the way. And if the current reimbursement
Yeah.
model isn't doing it, we need to fix it. We need to fix it. That's the solution. We need to make it so that that isn't a choke point, so that some new technological, some new technology can be put into the hopper, without it causing major problems on the other end. And so that is important. What does that mean? I don't know exactly what it means. Maybe we need some new L codes. Maybe they need to loosen that up. The standard for getting a new L code is pretty strict, as I recall. I mean, you got to sell a whole bunch of units or something like that first. I mean, there's all sorts of crazy rules around it. It's like, well, this doesn't make any sense. How does that help development? That, of course, is where your technology comes in. Because if you don't need to build as many prototypes, then you lower your cost. And maybe prototyping seems cheap, but it's not. There's nothing cheap about prototyping. Prototyping costs you time, a lot of time, and time is expensive. Time is labor. Labor is expensive. People are expensive. And you spoke to the other problem. What people, right? Right. It's harder and harder to find the qualified people. Well, if you don't have as many people, and if time is money, then if you can introduce something that will let you do things you couldn't normally do and do them quickly and do them with fewer people, then that's going to save you a lot of money. And that's going to lead you in new directions. That seems like the smart move. So yes. Go ahead. Sorry.
Yeah. The other angle for us is sort of lowering the barriers to participating in innovation. There's no reason why anyone with an interest in this field can't get on an emulator system and start testing out the ideas
Yes.
that they have. I think this is huge, and I think we'll prove this in time, but it's going to take time. Historically, you touched on this earlier when you were talking about how innovation sort of bubbles up within a cottage industry. It was only the most exceptional prosthetists with the financial backing and the business wherewithal that could actually take an idea into a prototype and maybe into a product. I see us on a crusade of kind of not just speeding up that process, but greatly increasing the kind of breadth of innovation. Because I mean, anybody could have the next big idea in their head. They don't necessarily need to be an engineer or a prosthetist.
I look, I think you're absolutely right. I mean, there are a number of players in the industry who, have created, a bunch of interesting products. Their interest is because they lost a leg, and maybe they used to be a downhill skier,
Mhm.
raced snowmobiles or whatever, or skied, and so they were like, well, why doesn't the knee do this? And so they went to the drawing board and they got themselves a CNC machine in the garage, and they milled some aluminum, and the next thing they made these things like the Moto knee, good example of that. And before that, I think the X9, I think, was preceded the Moto knee, and there were some others, and a lot of them did the same thing, which is they basically they resisted flexion, and so you could put this knee on, and sure, it wasn't a great knee to walk around the block on, but it was a great knee to go down the slope on skis, or to water ski, or to do something like that. And so, you know, and what do these kind of products do for us? Well, they introduce new technologies and new ideas, and just and getting out of the box. I think, yeah, it would be terrific to see folks like that with access to emulation technology, where they could really fly and really sort of let their ideas grow. That would be terrific.
I feel like we see a lot more of this kind of activity in upper extremity, because you can, with fairly basic skills and equipment, rapidly design and build sort of interesting attachments and mechanisms to do tasks with upper extremity prosthetics. Whether or not that's the ultimate solution for that sector of the field, I don't know. But it is really exciting to see just sort of the participation by actual users in the innovation process, in the manufacturing process. I think that's awesome. But with the lower extremities, it's just so much harder. I mean, there's so much more stress and strain on the products or on the devices, and the materials are more exotic, and the equipment to build them is more expensive. So yeah, we're not there yet. We're not to the point where someone who needs a new foot can walk into our lab and design and build it and walk out that same day. But they can emulate it. They can experience what could be. And we do have some potential new projects cooking around, how you could build a sort of passive foot custom and very quickly.
That's very
So
cool.
stay tuned for that.
Looking forward to hearing about that. But yeah, no, I think you're right. I mean, I think the dream of someone coming in and being able to try out an entire library of feet or knees or whatever on a single emulator. I mean, I think that's exciting. I talk to amputees about this all the time too. I say, look, talk to your prosthetist, ask them to get the reps to come out. But that's the time-consuming process. But it's the only option now. It's like get the OSA rep or the Otterbach rep or the Filau rep or the Protea rep to come out and bring a knee or knees and feet, and they're going to set aside a whole day just to try a couple of things. By the time you fussed with it and aligned it, and none of it's optimized. But to be able to put on an emulator and to be able to trial a whole variety of products in a more optimized fashion, and to be able to really narrow it down to it's like this is the direction I need to go. I mean, I think that would be fantastic. Absolutely fantastic.
Let's do it. So I've been wanting to ask you if you could snap your fingers and realize a prosthetic technology for your own personal use. What would it be? What's what like, give us an idea of like, what are the gaps you face in a day-to-day?
Okay. I'd like to see further improvements in socket technology. I mean, I'm involved with a couple of companies that are doing that. I think self-adjusting sockets, adjustable sockets, I think are here and should be standard at this point. I think they should be the standard of care. I like the idea of a self-adjusting socket. I actually brought that up back in 2014, when we were first looking at different tensioning systems for sockets. It'd be really cool is if I started running and this thing tightened up on its own. That'd be really cool. They're like, you'd like that to happen? I'm like, oh yeah. And so it's nice to see a group working on that. So that's really cool. So that would be neat. I like microprocessor knees. I like smart knees. I like smart technology. I'd like it to get a little lighter. That would be cool. The people worry a lot about the weight of their socket. Don't worry about that. It's close to the center of mass. It's your knee and your foot. It's the swinging pendulous weight that takes more of your energy. So I'd like to see them continue to lighten those. Oh, and reduce the build height. They never reduce the build height. It's so frustrating. It's like in Panamini dissections, an 11.5-inch knee is a lot of knee. And by the time you put adapters, there's no room left for the kind of feet that you want to use. So that would be cool. I like powered feet. I would be really, one day I have this vision of a bilateral amputee, above the knee amputee, running the world's fastest marathon time. And I, with powered knees, right? And not exactly go along for the ride because it'd still be hard work. But you know what I'm saying? I mean, I see that in the future. I see a prosthetic athlete, an athlete wearing prosthetics, being able to finally do what guys have been trying to do for decades, which is try and keep up with able-bodied athletes, but actually running faster. That would be a trip. I would just love to see that one day. Just true bionic limbs. That would be so cool. So that would be great. Oh, and being able to control them just with my mind. That would be so cool to be able to straighten bend my leg just by thinking about it. I mean, DARPA's been working on that with upper extremity stuff for a long time, I think. I don't know how far along they've gone, but that would be neat. So yeah, a lot of crazy sci-fi stuff obviously would be cool.
Fantastic.
Durability is important. Polycentric knees. I'd like to see more polycentric knees. Single axis knees have big limitations. I'd like to see more quality polycentric knees, not just cheap throwaway knees. I'd like the high end stuff to be polycentric. That would be nice. And yeah.
And you're this is sorry, going to sound ignorant, but are most microprocessor knees also polycentric or no?
No, they tend to be single axis. I mean, single axis knees have advantages. Well, the advantage is simple mechanically, right? And it's more durable. And so polycentric
knees, like Ottobock always made that little tiny 4-bar, and which is the first knee I ever had. A lot of runners used to use those because of that. And then the total knee, the whole range of total knees, they were polycentric. And I think Ottobock made the 3R60. That was a polycentric that was popular for a while, but that wasn't very durable. I mean, you can't run on that, So it would be nice to have like a cool microprocessor knee with a shorter build height, polycentric knee setup, because you want that apparent dorsiflexion. Ultimately, powered ankles, right? Ultimately powered ankles. And then, because I remember having a conversation once with a journalist about Oscar Pistorius. They were talking about whether I felt like his blades gave me an advantage. And I said, well, they're lighter, but and they give you back like 90% of the potential energy, whereas your tendons are giving back like 40%. But, an able-bodied athlete is adding 240% plantar flexion. He's getting 0, 2 big bagels. So that's why you'll see sometimes they'll build up a head of steam like a train, and they slowly build up as they're getting more and more of that potential energy and rebound. And that's great. But it would be interesting to see true bionic, true powered ankles and knees. I mean, I know that stuff gets complicated and heavy, but it'd be nice to see it develop and to develop with different technology.
Well, we've got to get you to come back into the lab and experience some crazy amounts of power. That's the fun thing with emulation. There's really no limits.
That'd be fun.
We've done some preliminary explorations of kind of reducing metabolic cost, increasing speed. Not, no one's running marathons on emulators yet, but it's certainly possible. Yeah, weight is your big enemy. And that's one of those things that may take a quantum leap in technology development, but most of everything else we've talked about doesn't. So, all right, Geoff. Well, we're up on the hour. I really appreciate your time, and I have one last question. Always a stumper. I'm hoping you can share with our audience a call to action. If they've made it to the end, what's a motivating statement you can share with our listeners?
It's gotten better. It's all gotten better. It has. I mean, I've seen advancements in technology. Now, I know sometimes people say, "Oh, that's so amazing that they can do that now." And part of me wants to say, "Well, they could have done that, 30 years ago, 40 years ago." But that's that part of me. The other part of me is just happy that they got there, right? So it's gotten better. I mean, I wear a microprocessor knee that knows when I'm running, right? I can be walking. Like last night, I was putting my kid on his bicycle, and because he just, he got his big brother's bicycle. Big brother, aged out, and now it's his, right? So he's got a much bigger bicycle. It's a lower the seat. He's riding up and down the block out front of the house, and as he's going, I'm just running behind him, right? And I didn't have to stop, go upstairs, put on my running leg, realize that I don't have the right liner, go find it in the closet, put it on. Like 2 hours later, I come back downstairs, and now I can stay behind the kid, right? But that was my old life. So the nice thing is that some of these technologies really have come along. So so hats off to Otterbock for that. The X3 is an excellent knee. It's expensive and it's hard to get, but if you can get it, right, then there's that good, right? There's the things are happening, and to be able to just run along with my kid without thinking about it, or having to change my prosthetic. That was my goal for decades, right? It's like that was my goal for decades. And yes, companies are out there doing things with socket technology. If you're an amputee, or you've got a family member who's an amputee and they're not happy with their prosthetic socket, get online, have a look, Google adjustable sockets, see what comes up. There are companies out there. There's Limb Innovations, Martin Bionics. There's that company in Canada, Vessel, doing exciting things. And it's like there's stuff happening. So that's what I used to do. I used to, before I spent my lunch breaks playing COO, I spent my lunch breaks Googling for new technology. I swear I used to do it weekly just in case something had popped up, And it's, and like I said, if you're an amputee or you've got a family member, and there's a lot of people out there who have family members who are amputees, and a lot of them are struggling, then yes, have a look online, see what's out there, because there are developments. They are cool. And if you've got a family member, don't be afraid to advocate for them. You don't have to be an expert. Just call up the insurance company and yell at them. Why does my dad have a leg? What are you doing? What are you doing? What do I have to do? Tell me what to do. Right. And does that help? Is that a call to action?
That's amazing, Geoff. Yeah, thank you so much. Lastly, this is an easy one. If anyone was inspired by your words today and wants to learn more, wants to connect with you, what's a good way to find you online?
Well, they can just shoot me an email. That's probably the safest. So my email address is Geoff L. Turner at Gmail. So it's spelled funny. It's Geoff. Sorry, English. Apologies for that too. So GEOFFL Turner, TURNER at gmail.com. Feel free to email me. Happy to chat.
Love it. And we'll put that in the show notes. All right, everyone. Thanks so much for listening.
Thanks, Ian.
Goodbye.